Good evening, everyone. My name is Hinisha Jones, and I am the Vice President of the West Garfield Park Youth Council. And we believe that we are the solution to the issues in our community. Excuse me. Our theme is Nothing With Us Without Us. The West Garfield Park Youth Council is sponsored by Fathers Who Care, which is a nonprofit organization located on the west side of Chicago within the West Garfield Park community. Again, everyone, my name is Hinisha Jones, and I am the Vice President of the West Garfield Park Youth Council. The West Garfield Park Youth Council is comprised of young people around our community whose focus and concern is youth leadership and a voice within the community to reduce senseless violence and illegal substance use. We invite people from all over, especially young people, to come in and see what we are all about. Our shows will be scheduled every Thursday at 7 p.m. Again, that is every Thursday at 7 p.m. Our shows can also be viewed online at www.cantv.org/live. Again, that website is www.cantv.org/live. Well, everyone, I would love to introduce my guest for today. This is Dr. Tanya Sorrell. And if you would like to introduce yourself.
Thank you. My name is Tanya Sorrell, and I'm a psychiatric nurse practitioner with a PhD in psychiatric services and behavioral health nursing and a minor in complementary and alternative medicine. And what that is the cultural activities and practices that we do every day and the cultural practices from our ancestors. How do we bring those into healthcare and medicine to help our behavioral health, emotional health, and mental health?
That's amazing. So thank you for being a guest on tonight's show.
You're welcome.
Again, everyone, my name is Hinisha Jones, and I'm the Vice President of the West Garfield Park Youth Council. You are watching a live interactive call-in television program brought to you by CanTV 21. During the next 25 minutes, we are going to discuss the importance of behavioral health and wellness on the west side of Chicago. We invite our viewers watching to engage via social media to better help us with ideas and thoughts on how we can better help our young people. So today's topic again is the importance of behavioral health and wellness on the west side of Chicago. And now, Dr. Sorrell, I have a few questions for you. Tell our audience, who is Dr. Sorrell and what is your purpose for existing?
Now, that's a heavy question, our purpose for existing.
Very loaded.
But, truly, I feel my purpose for existing, and I've had this all my life, is to be able to truly help others. Mm-hmm. A lot of times people may say, oh, I want to help you. No, I think even growing up in the church, and even when I was 5, my grandmother told me, you will travel around the world, learn many languages, and help others. So amazing. I knew from the start that was not only the calling, but the prompting to say, hey, this is what I'm doing. So that actually brought me here in 2020 during COVID, before the vaccine, because I saw what was happening in terms of behavioral health and particularly substance use. And I was hired by Rush University Medical Center to develop Rush's Substance Use Disorder Center of Excellence for bringing health care and behavioral health and substance use care directly to the community and providing those services, those needs, and understanding those needs better so that we really could make a difference for behavioral health and substance use issues.
That's amazing. So where'd you grow up?
I actually grew up in Louisiana.
Oh, nice. So why are you so motivated in the work that you do?
Because it's needed.
Yeah.
We're having more and more deaths every day from opioid overdose. Mm-hmm. Just in Chicago alone, in 2022, over 2,000 people died from opioid overdoses.
2,000?
2,000. That's the highest rate from any time that we've started recording overdose deaths. Mm-hmm. And that's somebody's uncle. That's somebody's sister. That's someone's dad that needed those kids left without them. And that's why being able to make a difference, to be able to help the population, and particularly people of color, is a calling for sure that's worth developing all of the resources, the services, and the research to be able to make a difference. Yeah.
So what is the state of behavioral health and wellness on the west side of Chicago right now?
Sadly, the state of behavioral health is in a crisis. Mm-hmm. When people want to get help, it's difficult to access care. There might be waiting lists. There might be, I'm having a struggle with my mood. I need help. Okay, well, we can have an appointment for you in 2 or 3 months. someone may not make it to that 2 or 3 month
Right.
time. So we know that there's an issue with access to care. We know that sadly, particularly with people of color, Black and brown people, we tend to kind of, we'll just push it back, just hide it, don't say anything about it. And so it comes out or erupts in depression, suicide, substance use, or violence.
Right. So when it comes to people who have like issues with opioids and things of that nature, like how do y'all get in contact with them? Like, is it only like, if they call you guys, or do y'all actually like go out into the community and try to like find these people who y'all feel like y'all can help?
That's exactly what we do in what we call community behavioral health, and that's the department that I work in at Rush University. We go out into the community. Sadly, part of some of the issues with healthcare is when people think about going to the hospital,
They think about the bills and things
they
like
think
that.
about the building. They think about when they had to go there and somebody died. They think about how they may have been mistreated or sadly discriminated against when they had a healthcare encounter. So what community behavioral health does is it takes all the resources, the knowledge, skill, and expertise of the hospital, but we put it in people who look like the community, and we go out into the community.
Right.
So we will do trainings, services, and provide substance use education at a laundromat, at the library, at a food pantry.
Yeah.
Because persons who use drugs go to all of those different places.
Right.
You know, there's another group, the West Side Heroin Opioid Task Force, that we collaborate with frequently. They actually sit and have a booth right there on the street at Chicago and Pulaski, because that's where people are coming and purchasing drugs. So right there and then they can say, hey, at least have Narcan. Narcan is a medication that we give out for free. It's $50 if you go to Walgreens, but we give it out for free. That actually will reverse an overdose and prevent an overdose death. But
Yeah.
sadly, a lot of people haven't heard about that. Have you heard of Narcan before?
No, I haven't heard about Narcan until last week when I met the doctor that I interviewed last week. Frederick. Dr.
Okay,
Frederick,
Dr.
yeah.
Frederick, yes, I know him.
I interviewed him last week, and that's the first time I got introduced to Narcan. Before that, I never knew about it.
And that's unfortunately what we frequently hear when we go into Black and brown communities. And people will tell us, I had a loved one that just overdosed a month ago. And we will let them know Narcan has been available, sadly, for years, but many people in Black and brown communities don't know about it.
Yeah.
And unfortunately, that means that they don't know, and that knowledge, unfortunately, can lead to death.
Right.
So we get out there and we make sure everyone knows what Narcan is, they know how to use it, and they know when someone might be having an overdose too.
Right.
And they also learn the most important thing is whether you've taken an opioid or are overdosing or not, Narcan won't hurt you.
Right.
It only can help in saving a life. Everyone wants to be Superman, Superwoman.
Yeah.
Being able to do that is a wonderful blessing.
Yeah. So when it comes to because earlier I mentioned like them worrying about bills, but you said that sometimes they're more so worried about like the building and like having like a sort of connection to it. When it comes to like bills and stuff, like with the hospitals, like do they have to ever deal with things like that?
Help me understand what your
Like
question.
those like hospital bills and stuff. Like if it's
The
people,
bill.
Yeah.
Oh, the finance bill.
Yeah.
Well, one thing about community behavioral health is, of course, everyone needs to make a living and everybody has to get paid. But
Right.
one of the things that we do is we apply for grants
Yeah.
and programs that allow us to be able to go and help people for free. And one important thing even that Medicare does, Medicare provides for substance use treatment. And a lot of people don't know that.
I didn't even know
That
that.
if
till
you
right
want
now.
to get help, if you want to get better, if you've gone around that merry-go-round of using and then going into withdrawal, and withdrawal hurts. That's why people keep using. People don't wake up and say, I want to die today. People wake up and they're hurting because they may be withdrawing from heroin or fentanyl or substances that they're taking, and then they go to use so that they won't still feel those bad withdrawal effects. When you're ready to look at coming to get help, Medicaid covers for free behavioral health services, substance use services, medications that can help you to stop using heroin and to get your life back together. And that's what so many people don't know. So we go out and let them know that.
I honestly feel like that should be something that's taught in schools, because I don't feel like a lot of like high schoolers and things like that, they don't know that. I feel like the only way they'll probably learn is if they went to college and studied like medicine and they got into the things like that. But I feel like a lot of kids now, it's very prevalent that they're using drugs.
Sure.
So I feel like they should know about things like this too, but it's nobody that's really coming out. Like I didn't know that it was people who went out and were just like, oh, here's Narcan, here's how you use it and things like that until right now. So I think that it should be not like promoting, I don't feel like not us, but you all going in schools would be promoting it, but it would just be like helping them become aware of it so that they know like that it's options, so that they're not ever like just suffering and they feel like there's no other way, like that they have you guys to come to if they ever needed like advice or ever needed Narcan.
That's a really good point, and that's really bright that you mentioned that. Many people used to think, well, if we go into schools and talk about mental health or talk about suicide, that it's going to make people want to do it. Or if we go in and talk about substance use or Narcan, that it's going to make kids think that it's okay. And that is not the truth.
No, it's not.
It's one of those urban legends.
Yeah.
When we provide education, people know that they have resources. They know that they can get help. And we're actually working with Chicago Public Schools to be able to get the word out.
That's good.
It's taking a little time,
Yeah.
but we know, just like you said, and programs that used to say, just say no, that doesn't do anything.
Yeah.
In this day and age of the TikTok challenge, you know,
Right.
or our generation, it used to be hold my beer. I'm going to go do it too.
Right.
No, so just saying no, sadly, just left folks alone and isolated and suffering in silence. And that suffering and that silence is what leads to suicide or overdose deaths. Now we're saying, hey, we know that substances are out here. We know that folks want to experiment. But with experimenting, unfortunately, in these days with fentanyl, one experiment could unfortunately be a death. So if you're going to experiment, there's certain things that you can do.
Exactly.
The first thing is never use alone. Never use by yourself. Always have somebody there with you. Also, don't everybody use at the same time. Use just a little bit and let somebody be there and have Narcan. So if you fall out, they can be right there with Narcan. If everybody uses at the same time and there's fentanyl in it, everybody might die, and there's no need for that.
Exactly.
So we actually teach what's called harm reduction, how to reduce, if you're going to use, how to reduce the harm in using, so that you don't die.
Yeah.
Because even kids might buy Adderall off the street thinking it's going to help them with their tests, but that Adderall could be laced with fentanyl. And do you know what fentanyl is? Fentanyl is a very, very strong opioid. So many people have heard of saying using heroin. Right?
I heard like heroin and fentanyl,
or
but I don't know.
OxyContin. That's another opioid. Opioids are medications that usually are used for medical issues like pain, severe pain or cancer pain. But when someone's having emotional pain and mental pain, pain is pain.
Right.
And so people may start using an opioid or OxyContin, and oh wow, not only did when I broke my ankle playing basketball, that helped that, but it also helped that hurt inside, or it helped that abuse, or the issues I had growing up, all of that left. And so people start to use opioids to get rid of the emotional pain they have. But then when they stop using it, then they'll start to have withdrawal symptoms. And that's when they may develop where they continue to use, and they may buy something off the street, which is laced with fentanyl. So say this is a pain pill, and it's this strong.
Right.
And then heroin is this strong. Fentanyl is this strong. And if you're not used to it, it can accidentally cause an overdose. And an overdose is because all of those opioids are very sedating. They tell your brain to settle down and calm down. And if they're too strong, they can tell your brain to forget to tell you to breathe. And if you forget to breathe, you die.
Right.
And that's how someone overdoses. So the Narcan will actually, and Narcan is very simple to use. It actually comes, I don't know if Dr. Tedrick brought it, but it actually just looks like a nasal spray.
Yeah, like the little white thing. Yeah.
And if you spray it in one nostril, if someone has passed out and you try to shake them and wake them and they don't wake up, you just spray it in their nostril. In 2 minutes, it'll knock the opioid off that part of the brain that tells you not to breathe, and a person will start breathing again.
Wow, how
So
can
you
something
literally,
do that? That's crazy.
you literally can save a life.
That's
because
crazy.
the medication that's in Narcan, it's called naloxone. It actually goes to where opioids work in the brain, and it says, get off there. Get off of that person's brain. And that person will then wake up.
That's amazing. So when it comes to like when people be like, just say no, I feel like when they do that, I feel like that kind of makes a person, like if they ever wanted to experiment, that makes them feel bad and not want to go to anyone about it, because they're like, oh, just say no to it. And then they're just like, you know, like it's life. Like people gonna try to experiment and do certain things, so then they not comfortable going out to talk to people about it. And then if the only response they're giving is just say no, they're not getting educated about it at all. So it's like you telling me like how fentanyl is like a really high, really like bad drug. Somebody else might feel like you just saying don't use drugs. Well, you just saying that, you just saying just say no, where I'm going to use fentanyl anyway. And they might use it not even knowing the harm of it. But while you just trying to be like, don't use drugs, blah, blah, blah. It's like they not going to know what drugs they should start off with or shouldn't start with or something like that. Not saying to promote them using drugs, but like just let them be safe if it ever was to occur. Don't leave them in the blind, because that could like harm them in the long run.
You are so exactly right. Everything you just said is what we go out and let people know.
That's good.
Exactly.
So why is the life expectancy rate different for people on the west side and those on the north side?
Very good question. We know that what they're called social determinants of health, those are where you live, where your neighborhood is. Is it safe to go walking and exercising? Does your neighborhood have a grocery? Or are you having to kind of buy something at the little bodega at the corner drug? Or do you have like a full, grocery store? What's your economics like? All of those things we recognize have led to what they call changes, so that if you live here in Austin or the west side versus living way up north toward Evanston, or even way down south heading toward, Tinley Park and Lenox City, that those people live longer than folks living on the west side. And they've recognized that there are 5 medical illnesses that cause that. Cardiac issues like heart problems, high blood pressure, and diabetes. Cancer. Infant mortality. That's when a child is born, having enough nourishment, having enough family structure, having enough safe environment that the child lives to grow all the way up. Violence.
Right.
And substance use overdose.
Yeah.
Those 5 things are what literally causes a 10-year gap. The average age of people living on the west side is about 67 to 68. On the north side, in northern Cook County, and in the southwest side of Cook County, it's 78 to 80. Wow. So those 12 years are caused by those 5 diseases. And this kind of harkens back to something that you said earlier. The just say no, if you were thinking about it and someone told you just say no, then it makes you think, oh, there must be something wrong with me. Right. I must be a bad person. And we sadly made substance use a moral issue or a will issue. Because if you can't just say no, then that means something's wrong with you.
Right.
When we knew all along that it was a medical disease. Benjamin Rush, that's who Rush is named after. He signed the Declaration of Independence. When was the Declaration of Independence signed?
1860.
Close.
Don't tell me.
Okay.
Ooh, 1862.
Think about, it's kind of close. 1776. That makes sense?
Oh, no.
So Benjamin Rush was a doctor way back in 1776, and they knew that alcohol use disorder was a medical disease and opioid use disorder, or heroin and fentanyl use disorder, was a medical disease. They made it into a moral thing. And now we're bringing it back to a medical illness, because if, just like you said, if someone says just say no, but your mind is thinking, but when I used that, I felt better, then that must mean I'm a bad person. And it's not anything about that.
Yeah.
When you use a substance over time, it causes your brain to say, oh, I want that substance because it took that pain away. Yeah. And then it changes how your brain works, so that your brain is like, I want that substance. So when people might start to steal things in the house, it's not that they don't love their family. It's that their brain is telling them, I need that substance right now.
Right.
Whereas we used to talk, oh, well, you must not love your family. You're stealing from them. But the person isn't thinking that they don't like their family. The person's trying to calm their brain down. And now we have medications, so that it's called medication-assisted recovery, so that we actually have medications that can help to calm those withdrawal symptoms, to calm those cravings to use. You know what a craving to use is?
A craving to use is like craving to use something.
Yeah. Oh, I got to use it no matter what.
Right.
Exactly. And when we prescribe medication-assisted recovery, if someone may use a substance again, or may, kind of feel like they're stressed and start using again, it'll keep their brain from going into that likelihood of overdosing.
Right.
Because it'll keep, remember I said like the Narcan will take that opioid off of that part of their brain?
Yeah.
It'll do the same thing. And so when we prescribe medication-assisted recovery, it actually helps somebody to not use again, to not have cravings, to not have withdrawal symptoms, and then they can figure out the coping skills, deal with the trauma, the depression or issues in their lives, and be able to then get their life back together.
That's amazing. Okay.
It really is. That's the research we do every day.
I was going to ask for contact, but we're going to do that later on.
Okay.
So as some may know and others may not, you just hosted Chicago's very own first annual Blue Christmas. Can you give a rundown on that to those who may not have known what the Blue Christmas is and the reasoning behind it?
That's a great question, and we had such a wonderful celebration with over 100 people in attendance, including our local representatives, Representative LaShawn Ford, Camille Lilly, Representative Omar Williams, all right there to recognize that many people have lost loved ones to overdose death.
Yeah.
And when you lose someone to an overdose death, you not only have the grief of their being gone, but you have that same shame and stigma that I was talking about earlier.
Yeah.
Oh, well, not only did I lose them, but I lost them, because of substances. Or what could I have done differently? So you feel all kinds of regret. And so that Blue Christmas service is a remembrance for anyone that's lost their lives to an overdose.
Yeah.
Those family that are left, we come together, we support and encourage and help people process that grief. Because they also suffer in that same grief silence and stigma. We all got together, we ate, we talked, we sang, and had a wonderful time. And we talked to our representatives to say, what are you doing to help?
Right.
Because we need help in our communities to be able to stem this and stop this crisis.
Exactly. So how is the opioid crisis currently affecting people in the city of Chicago?
As we said, with over 2,000 people that have lost their lives just last year, that's significant. A more concerning issue is that although the population of Chicago is about 30% Black, the number of people that died of overdose deaths,
The population in Chicago is 30%?
It's about 35% Black, yeah.
I didn't know
The
that.
number of people that died from overdoses were about 70% Black. So more Black people were dying from overdoses than even is their general population, because they didn't know about Narcan. They didn't know about the help that was available to get help.
Right.
And if they may have called to try to get help, there may have been a delay or something like that. And so they weren't able to reach out for help when they were ready. And that's why we work to make that difference, to let folks know that help is available.
That's amazing. So what is the inequality in health for people of color, and how can we advocate for them?
That's that same issue. That 40% of the population and 70% of the illness is in most of those things that I was telling you about earlier. High blood pressure, diabetes,
the five
things, yes.
Yeah.
So that's that inequality. Although there are fewer people in the population, more of a percentage of people are having those health issues, mental health and substance use, and medical issues like diabetes, high blood pressure. And we need to be able to get help out there to the community so that we can identify if someone has high blood pressure and get it treated. We can do mammograms so that we can screen for breast cancer. We can screen for colon cancer. Remember Chadwick Boseman
Died from that.
died from that, and he was only in his 40s.
Yeah.
So we need to know to be able to screen for cancer, because if we check it every year to see if someone may be at risk for cancer, it's so much easier to treat than when someone goes in because they're having symptoms.
Right.
That means the cancer has already gotten worse or is spread.
Yeah.
So if we can do what's called prevention, checking to make sure, and at health fairs, checking your blood pressure, checking your weight, checking your risks, then we can decrease those numbers and bring those inequalities back.
Right. So do you have any advice for young people that desire to improve their quality of life?
Yes, some really good ones that I think have been really helpful. One, realize that you are important. We need you here. It might be tough what you might be going through right now, but there's folks that can listen and care.
Yes.
And it's okay to reach out for help.
Yes, I feel like that's very important.
It's
because
okay
young
to
people
reach
don't
out
wanna
for help.
reach out.
It's tough. It's tough. Hey, look around. It's tough for the grown-ups.
Yeah.
So we know it's tough for kids. And we know it's tougher because there are things like social media that even your parents didn't have to deal with like you have to deal with now.
Yeah.
So we know it's tougher now than it was even for us.
Exactly.
But we know that help is available. And it's okay to say you're not feeling okay.
Yeah.
That's the first and most important thing. Secondly, exercise however you can. We need to get our steps in during the day. If you don't live in the neighborhood
I was
that's
just gonna mention
easier,
that, yeah.
if you don't live in the neighborhood that's it's safest to be able to go walking, what are the things that you can do? Where can you exercise? At school, join a club. There's services available to help. And then your nutrition, good nutrition.
Yeah.
Don't want to eat too much, don't want to eat too
Too
little. I
little,
know it's
right.
Christmas coming up. We all want that turkey and a little bit of dressing.
Yeah.
Eat healthfully and eat your vegetables.
Yes, that's
And
very
fruits.
important. So if anyone would like to get in contact with you, how could they contact you?
The main way that most folks contact us is through email. Our email is, of course, it's Rush, SUDLC at rush.edu. Rush, SUDLC at rush.edu.
Thank you.
Thank you so much.
So if you are just tuning in on our show, our guest tonight is Dr. Tanya Sorrell, and we were just discussing the importance of behavioral health and wellness on the west side of Chicago. We would love to thank our viewers for watching. For additional information about our youth council, please contact us at 773-287-5821. Again, the number is 773-287-5821, and ask for Ms. Princess or Ms. Vernisha. Thank you, and tune in next week, same time, same station, as we present our first episode of the Fathers Who Care show with Reverend Jones. Bye, everyone, and happy holidays.